Okay, so for week 2, we're going to talk about chapter 16, and this one is in the Nave textbook. So this book starts out with the introduction to research, in that research is for anyone who's ever had a question or who's ever wondered something. And research, the research process that we go through is the method with which we can use to find the answer to the question that we might have. So the process is going to be that we have some type of question, and then the next step is going to be figuring out why that question is significant. Is it something that's worth looking into? Then we need to figure out what's already known about that topic. Has someone else already found the answer to our question? And then after that, it's going to be, how do we figure out how to answer the question? What do we have to do in order to find our answer? So our research question is going to lead us to something called the hypothesis. And this is different from, your 7th grade science hypothesis of an educated guess, right? Well, essentially, our hypothesis can be an educated guess, or it can be just an educated question, and it's something that can be answered. So if you wondered something that there was absolutely no possible way of finding the answer to it, it's not necessarily a hypothesis, it's just a random question, okay? When we have a hypothesis in research and we say, I think that, whatever this is significant. I think that there's a difference between these two things. One causes the other, right? That's going to give us our research hypothesis, or it's also called our positive hypothesis. Sometimes if you're reading like the patent book or you go online, it's also called our alternative hypothesis. Because in research, we kind of like, we go with that there's no association, or there's no, significance unless we prove otherwise. And so if we say that there's no association or there's no relationship, it's stating the null hypothesis. And basically what we're trying to do whenever we conduct research, we collect data in order to try to prove a hypothesis. We're actually trying to prove or disprove the null. We're never actually trying to find our question. I think researchers are just very polite individuals in this way. So we're always trying to figure out and come up with the evidence to support that the null hypothesis is incorrect. So in this scenario, the null hypothesis is that cats show no preference for food based on shape. So our research hypothesis or positive hypothesis would be that cats prefer the shape of fish-shaped food over triangular-shaped food, right? And then the next one is that plant growth is not affected by light color, right? So maybe in this research study, the individual is trying to see, does the pink light, retard growth, or does the yellow light retard growth for this plant? And so then the null hypothesis, the thing we're trying to prove or disprove, we're trying to accept or reject the null hypothesis, is that the light won't affect, the color of the light won't affect the plant growing. And then the last example here is that age has no effect on musical ability, right? So maybe our null hypothesis is that it won't affect it, but the research hypothesis is that, older individuals have more of a musical intuition than do younger individuals. So basically, in research, we are trying to either accept or reject a null hypothesis, okay? And it's the opposite of whatever you think is going to happen. So as researchers, we might say, we think that there's an association between cardiovascular disease and periodontal disease, but when we conduct research and we collect data, we are only looking for, we're trying to either accept that there is no association, or we're trying to reject that there is no association. Okay, so we have our question, right? We know what we think might happen, and so we know the null hypothesis. The next step in this equation of trying to find the answer to this is we have our question. So the next step is we need to collect information about what is already known. And in order to do this, we conduct a literature review. So we're going to come up with some search terms. Actually, we're going to do an entire module on how to conduct how to write and conduct a literature review, so we're not going to get too far into it, but basically we're going to collect several studies that are similar or somehow related to the information that we are trying to find in order to get a strong base understanding of the topic, so that we know we're not trying to find a research question that's already been researched, right? We don't need to reconduct or recreate a study that's already been done, that's been done well or thoroughly or exhaustively studied. We want to try to research things that are that haven't been researched as well, or that maybe we don't already know the answers to. And so then the next step after that is going to be to choose our research approach or our research design. So at this point, based on our literature review, maybe we don't have a lot of information about whatever the topic is. And so if that's the case, we might want to go with more of a qualitative kind of research design, right? We might want more, collecting information, or we might go and say, we want to try to do a historical type of research design. And we're going to talk about these research designs as we move forward. But the research proposal sort of scenario is, first we have a question, and it has to be a good question. We figure out what we already know about it, and then we choose how to find the answer to our research question. So the next step in a research sort of process is to potentially need to do a pilot study. So if there hasn't been a lot of research done on the specific topic that you're doing, you're not replicating anyone else's studies, then you're going to be kind of doing your own thing, right? And you need to figure out how the research study will be run, and a lot of things can happen, a lot of things can go wrong in the middle of your research. So what researchers will do is they'll conduct something called a pilot study. And it's basically just a small version of the proposed study. It gets carried out on a small, sometimes intentionally chosen sample. We're going to talk about samples a little bit more this chapter and then again later in the term, but we're going to specifically pick out people we want to be in our pilot study because we think that they will be good samples and will help give us the feedback that we need in order to evaluate our research study critically and in a manner that's going to give us the best path forward. And so it's a way of working out some of those unforeseen errors in the overall plan for conducting a study, which is called the research design by doing a trial run. So why would we do a pilot study, right? We already planned it out. We already did our literature review. We know a lot about it. Well, the reason we would do that is because a lot of things can go wrong, and you want to try to find if what your idea, if it's going to measure the thing you think it's actually going to measure. Because sometimes you get started on a research study and what you think is going to measure whatever it is actually doesn't. It doesn't measure it effectively, or it just doesn't relate to your research question, and so you'd have to scrap an entire large project. A lot of times if your study is large, and it's going to require money, you have to either get a grant through like the government or like a private grant. And in order to get people to give you money, you have to show that your research study is going to be effective. It's going to work. So you have to sometimes do a pilot study in order to prove that the study will study the thing you think it's going to study, so that the people with money will give you their money. And then there's a lot of bias that goes along with a pilot study. So I want you to be aware of that whenever you are looking up research and you see, whatever type of quantitative study, it's a pilot study. then you need to be aware that a lot of times in pilot studies, because they're choosing those samples, because the sample sizes are so small, there is a lot of innate bias in the research study. So the findings from a pilot study are not going to be as good as the findings from a study that's not a pilot study. Okay, so this is in your book, figure 16-1, which is on page 196. This is basically the components of a research study, and up until this point right here, everything above this is something that you need to kind of have mapped out in your research proposal. So you'll have your question, and that will be stated in your introduction, the statement of the problem, the significance of the problem, and the types of operational definitions. So this is where a lot of times they'll give you a little bit of a backstory. They'll define key terms and things like that in the introduction portion of the study. And then in the review of the literature, they will introduce the topic to you. They'll talk about the different points of literature that they found that are relevant, why they're relevant. They'll summarize, they'll basically like synthesize the different research studies, how they work together in order to show that more research is still needed, right? Because we have to show research is needed, except, because we want to show we want to do research. And then in methods and materials, this is where we break down the actual study we have that we want to do. So in this, we'll introduce the study basically we want to conduct a study comparing string floss to floss picks, okay? We will define our sample, how we're going to find the sample, like where we're going to find people, and if we're going to, exclude certain people, someone with severe periodontal disease, or, someone, children, things like that. We need to figure out, what kind of parameters are we putting on our research participants. We don't want to have too broad of research participants because it's going to potentially skew our data. Remember skew from the last one. So if we have, a couple of children and then the rest of our sample is adults, well, the children probably don't have as much calculus buildup, or they don't have as much gingivitis as do adults. So if we had, the vast majority of our sample was adults, and we had like 2 or 3 kids, they're going to skew our data. They're going to mess it all up. So we need to kind of have a pretty good idea of the sample, but then also when you think about your sample, you need it to be able to compare to the general population. So you want to have enough variety in your sample to be able to compare to the population, but not so much variety that it messes up your study. The research design is basically, how are we going to go about, collecting people and collecting data and getting informed consent and doing all of those things that we need to do in order to collect data on people. The procedures, so, you would map out. First we, reach out to people this way, and then we get informed consent, and then we, give the participants education, and you basically list through everything you do. Human subjects addressed is if you're using human subjects, obviously you're going to have to address consent and ethics and things like that in institutional review boards, which we'll talk about a lot in this term. The test that you use in order to find the answer to your question. The materials, the time schedule, things like that. So how long your study is going to be conducted over, is it just one point, or is it, a longitudinal kind of study? Any assumptions that you're making. So sometimes in research you have to make certain assumptions, that if you have participants and they say they flossed once a day with the method of flossing that you gave them, then you have to assume that they did what they said they did, right? Because in order for your study to move forward, you have to make certain assumptions. And then the limitations of your studies. So the fact that you were not at their house watching them floss every single day is probably a limitation, right? All of that information happens before you ever even talk to people and get them to go through with your study. Then is when you collect results and you talk about the types of results that you got. And then the conclusion is where you really start to synthesize the results. So, you know, in the results, you'll say, we had this many people improve, we had this many people stay the same, we had this many people get worse, okay? And then in the discussion, it's like, you'll break it down, like this specific demographic of women, you know, this percentage got better, this percentage stayed the same, this percentage got worse, and then you'll break down men. That's how discussions and results work. So you write the results of your study, but you really break it down and you put it into like charts and figures so that people can understand it really well. And then in the conclusion is when you come in kind of with your synthesis of the data. So you conducted the research, you collected the data, and now you think that that data tells you this information. So you say, you know, based on the information we have here, we think that floss picks are more effective than string floss, or whatever the answer or whatever the data tells you. Sometimes the data tells you that there is no difference between string floss and floss picks, and that's okay. In that case, the null hypothesis was true, and you have to accept it. Okay, so these are the two main ones that I think are really important to talk about. Obviously, there are so many other different types of research, right? There's, you know, there's experimental, there's quasi-experimental, there's historical, there's retrospective. There's so many different words to talk about types of research, but the two that I really want you to kind of remember and think about and really never get confused with any other types of research is going to be the difference between descriptive and analytic. So in descriptive research, you are collecting data in order to identify and describe what happened. Okay, so you're just collecting information in order to understand what's going on, what happened, in order to describe it and explain it, okay? And then in analytic research is where you want to establish the why behind the data. So in descriptive, you're kind of just like collecting the information, you're giving out statistics, and you're saying this and this and this and this and this is the way that it is. But in analytic research, you'll say, well, the data said this and this, and we think that that means this other thing, okay? So when we look at like prospective and retrospective, like retrospective looking backward, right? Retrospective is typically more descriptive, whereas prospective, we're trying to make assumptions about what's coming. That's more analytic, okay? So just if you can take the word descriptive and pair it with like describe or what, and then analytic, you just go ahead and pair it with the word why. Okay, so this chapter or this slide starts the table 16-1 research approaches, and this starts on page 198 in your NAITH book. The fact that they broke it down into this table doesn't mean there isn't any overlap. Like, so sometimes historical research approach still falls into like the descriptive realm, right? Because historical is describing things in the past. It doesn't necessarily mean there's no overlap. It just means that like when they say historical, they're talking about understanding the meaning of past events. Okay, so anytime you see historical, you know we're not talking about current events. In historical research, it's going to review records. So we might go to a hospital and we look at, you know, the number of patients who came in with coronary heart disease, and then we say, you know, do any of these patients have this other condition, right? That's a historical kind of study. And then they're conducted via interviews as well. So you're asking people about things that happened in the past. And then every literature review ever is historical because it was written before then, right? If it's published, it had to have been written before. Limitations of this is that the location of accurate data, gaps in knowledge, Sometimes people make assumptions in research that aren't necessarily true, and without having, reading the entire research study and understanding the research study, you may not be able to catch that it was an assumption that shouldn't have been made. There's not an ability to replicate the information, right? Because they collected the data that they did. You can't go back and collect more data from those people, right? Because it happened in the past. So you get what you get and you don't throw a fit. And then there's biased reports. So, you don't necessarily know that whoever took down that information wasn't feeling a certain type of way when they took the information. And then there's a distortion of events. So sometimes, people don't recall correctly, especially like during interviews, you ask people about what happened in the past, and they don't, they're going to give you what they think happened, but it's not necessarily what actually happened. An example for a historical type of research is the development of the ADHA community water fluoridation program. And now there's a lot of research happening on water fluoridation, but it all happened in the past. Okay, so the next type of research approach is going to be descriptive. But descriptive research approaches can be conducted with different types of research design. So when we look at like a survey, or if you're looking at the book, you'll see case study, cross-sectional. Those are all study designs that are all going to fall under the descriptive research approach umbrella, okay? A descriptive research approach is going to try to describe and identify current events or situations, right? And then in this one, it begins with the example of a survey, and a survey is sent out to gather broad information about status quo. It usually involves a very large sample size. How large the sample size is actually one of the biggest pros in a survey's sort of pro-con list, because the more people you can ask, the more reliable your data typically is. This is usually done through a questionnaire or an opinionaire. I don't know if I've ever used the word opinionaire before. This is done through interviews and indices. The limitation for this is that there can be a lack of depth. So, you don't want to ask people too complicated of questions because they may not understand the question. So you want to ask them pretty simple questions that are easy to answer so that they're able to do so. And then based on, how large your sample size is, you may not be having that kind of one-on-one, especially if you're sending out like a questionnaire via like the internet. You're not going to be able to have like follow-up questions to the ones that they answer. So they answer what they do, and you get what you get. The application example for this is going to be the use of pit and fissure sealants by dental hygienists. So they survey to find out how effective pit and fissure sealants are. And then the Carey's experience of high school sophomores, so they ask high school sophomores about what it's like to have a cavity, and how much those cavities or a toothache might affect the student at school, because that information is necessary. We won't know what it's like to have a toothache when you're in high school unless we talk to people who had them, but also we need to be aware that we might not, because we're asking them questions about their toothache, they might kind of play up the toothache a little bit more than maybe it really did affect them. The next one is going to be a case study. And this one's going to conduct an in-depth report on a single person, on a single group, a single event, or a single situation. And I purposefully put the word single against all of those others because I really want you to kind of pay attention to the fact that we're not studying like a sample of people. This isn't usually a very large group. It's kind of just one, right? So usually in a case study, you have a patient and they have something very unique about them, and you write a report about it. That is research, and you would look up information about whatever condition the person has or whatever it is, and you basically say, this is the intervention that I did on this one person, and this was the outcome that we got on the one person. In the methods, this is done sometimes in interviews. If you're the dentist or the dental hygienist, or you're the medical doctor of the person who's got this condition, you're going to be talking to them a lot, figuring out, how they feel and their subjective information. But you'll also use observation, and you'll figure out, we did this intervention, maybe chemo, or we did, non-surgical therapy, and we're going to, test to see if they got better. Testing was on there, and then a records review as well. So we're going to look in that one person's past to see, did any other doctors or hygienists make interventions, and how did it play out the last time. The limitation here is that the person is so unique that it isn't really something you can generalize to the overall population. So just because we learn something that works for that one person, it doesn't mean that intervention is going to work for all people who have that condition. Replication is not possible because you just had the one person, and it is subject to bias a lot. One, because it wasn't random. You didn't choose that person at random. They had the condition. You had to choose them. But then also because you knew the whole time that they had the condition, so you might have associated some of their symptoms with the condition when maybe it didn't have anything to do with that condition. So there's a lot of bias there. We want to learn as much as we can from people with case studies, but it's not the best type of research studying. So some of the examples here are orthodontic case reports. For patients who have severe malocclusion, sometimes orthodontists will record all of that. They'll document all of it, and then they'll kind of write up a report and share it with others. Aphthous ulcer cases, reports in 3 patients using 3 different toothpastes. That's a weird example, so we're not going to talk about that. So this top one, we're still talking about the case. There we go. The other things we can use are dental indexes and questionnaires in order to collect information about that person or that condition. And then some of the limitations, again, can be unrecognized chance variables might exist because of the number of samples. So I kind of already said that in the last slide, but we don't necessarily know because we don't have enough people to compare the information of. And then a periodontal assessment of children in grades 1 through 10. Yeah, I don't really feel like that's a good example either. A good case study is the orthodontics one. So, the patient has severe malocclusion, the orthodontist documents the case, writes up in some information, then the patient goes through braces, and the outcome is whatever the outcome is, and then, the orthodontist documents documents the outcome, and then publishes that information. That would be a really good example of a case study. The next one is going to be cross-sectional. So the purpose of a cross-sectional research study is going to be to study the cross-section of the population in a limited period of time. So basically in this one, they step in and they catch people right in that moment of time. So they say, I know you're in the middle of whatever is going on with you, but right now, how are you feeling? And then, of course, the cross-sectional is like that one point in time. So then the opposite of that is going to be a cohort or a longitudinal type of study. And this one's going to look at that same population over a period of time. So basically, that's why you guys are called a cohort, because you're your own little research study, and we're following you over your dental hygiene education experience, and we will see where you started, and we'll see where you end up. The limitation with a cohort study is going to be that it's a time-consuming process. So, depending on the type of thing you're studying, it could take years, and you may or may not want to spend the next 10 years studying the same people, or it may not even fill up all of your time. Maybe you study them in the beginning and then you don't see them again for 10 years, then, what are you going to do in the interim? an extended financial commitment. So when you get a grant, they'll say, hey, you can have this much money for this study, but you only get that much money. They're not going to give you that much money every year unless they specifically say they will. So, in order for you to continue living off of and working in that study, you'll have to get enough money to survive. And then loss of subjects. So attrition is like the #1 problem with these types of studies, because you start out and people are all gung-ho and they, sign up for the research study, and then, 5 years from now when it's time to come back in and, check the after, they don't come back. They've moved, or they are no longer interested in your research study. And so when you lose subjects like that, you can't use their data. So it's a big limitation for a cohort study. And then an example here is going to be changes in the children's periodontium over time. So like if we were studying maybe eruption patterns in children with Down syndrome, we would probably be following a group of children with Down syndrome over time. And then the next one is going to be document or content analysis type of research study. And this one is going to analyze documents themselves. So we're going to be looking at the types of documentation. Let's say we're going to go to a hospital and look at medical records, and we're going to see, how have medical records changed over time. This one's going to be an examination of records or documents for specific information or presentation style. I have a random thing to try to help you remember this, is that when I first started working in private practice, I was working with a hygienist who'd been kind of, I think she'd been like 20 years in practice, and everywhere in her notes, she wrote RTS, everywhere, recommended RTS. Patient had RTS from last time, or whatever it was. And it took me forever. I finally asked her, I'm like, what is RTS? And she goes, oh, it's a rubber tip stimulator. And I'm like, oh, thank you. I had no idea what your personal acronym was. But it's just a thing that, they used to use rubber tip stimulators all of the time. So I'm sure when she abbreviated it, it made a lot of sense to her. But it wasn't something that when I went through school that I learned a lot about, because it wasn't one of those, main adjunct aids. So you have to kind of watch and see how, not only language changes, but documentation style changes. A limitation for this is going to be that there is a lot of subjectivity in your evaluation. In this case, if you remember rubber tip stimulators from hygiene school and you were doing it, you'd probably think that was a perfectly acceptable acronym, whereas you might be like me and think that it's an unacceptable acronym. So it really depends on person to person. In this one, evaluation of dental journals for types of articles printed, maybe gender biases in dental hygiene textbooks. There's a lot of gender bias in dental hygiene and in dental in general. Just over the years, dental hygienists have been predominantly female and dentists were predominantly male. And while there's a lot more equality lately, I think that there's still a long way to go when it comes to some of the terms that we use. Okay, so the next one is going to be a trend study. This one is going to combine descriptive information, right? So current research or current data, not research, current data, and historical research or data to establish patterns from the past and the present in order to predict future. So at this point, we've talked about historical, we've talked about descriptive in the sense of being like current in the right now, and then we talked about analytical, right, where we might make observations moving forward, or prospective types of studies. This one combines all three. So we have information from the past, we have today's information, and we're going to use that information to synthesize a guess, an educated guess, maybe even you might say a hypothesis, moving forward toward other information. Your book gives the example of like sports drinks, so how much the sports drink consumption has changed, or the trend of sports drink consumptions, and then they give a a guess as to how much it will either go up or go down in the future. Method for this is going to be with records reviews, right? We need that historical information. A review of the literature, again, historical information, and just a good baseline. We would do this through interviews in order to collect the descriptive information for the present data, observations, and surveys in order to collect that. But what's nice about surveys is we can also ask questions about, what people intend to do in the future and see how much information they can give us there. The limitations for this is going to be long-range predictions are less valid, right? Just because the person says they're going to drink a Monster a day for the rest of their life doesn't mean they're actually going to do that, okay? They just say they will right now, but it could change, right? So if we come out and say, yes, 8 billion people are going to drink a Monster a day for the rest of the known time, then that's not a very valid, that's not a very good prediction to make. So we don't want to do that. And so we don't want to make long-range predictions. We're going to make short-range predictions. I remember when I first started as a dental assistant in school, they were saying that the dental field was growing by like 80% in the next 5 years. And then a couple of years later, I was in hygiene school, and they said that dental was growing 80% for the next 5 years. And I was like, well, they just told me that a few years ago. And then I just heard someone say that they think that the dental is going to grow. And so, we want to make those short range predictions, because the long range ones, they'll get thrown back in our face because they may or may not be true. ADHA actions between 1968 to 2008 regarding the expanded scope of dental hygienists. A good example of this is like they thought by the year 2000 that we would have flying cars. And that's not a thing yet, right? And so, I guess maybe by like 2050 we'll have flying cars, right? But then when 2050 gets here, we may or may not have them. And then the use of sugar substitutes in carbonated beverages. So we see a lot of this happening right now. It's really grown in the last few years, but we don't know necessarily that it's going to continue to grow at the rate that it has. The next type of research is going to be correlational, and this will only measure the relationship between two variables. So we learned about this last week, but if one variable goes up, let's say children watch more TV, then the number of hours they spend outside will go down, or their test scores will go down. That would be a negative correlation, right? Whereas in the summertime, when the temperature increases, then people typically drink more water, right? So when temperature goes up, water consumption goes up, right? Those would be positively correlated. So the method here is that we just collect a bunch of data about two different things, and we plot them on a graph. The limitations is that there's no indication that correlation indicates cause and effect relationships between variables. My favorite saying is that correlation does not equal causation, which we're going to talk about that in a bit too. And there's a plausible rival hypotheses. So a lot of times that, when you say that these two things are correlated, someone else can step in and say, well, I think that they're probably the same because of this totally other reason that isn't something you studied. Application examples is like the frequency of flossing and periodontal disease. So people who floss more probably have less periodontal disease, right? But that doesn't necessarily mean that flossing more reduces periodontal disease, right? We just know that when one goes up, the other goes down. Pre-dental hygiene grades and clinical dental hygiene grades. So, just because you did really well in your gen eds doesn't mean you did fantastic at preclinic, right? And vice versa. Just because you're fantastic in preclinic, maybe you were terrible at English, and that's okay. The next up is retrospective, or a casual comparative, or ex post facto. So ex post facto is like the Latin phrase that just means, retroactively or from before, right? That gets enforced now. And it just means that we investigate the existing differences to determine possible causes. So we basically, we kind of reverse the, well, it says it right there, reverse the experimental approach. So we say, here is the outcome. What were the factors that played a role in this outcome? And we kind of move backwards in space. We're like detective working. The methods for this is that we reverse the experimental approach with the independent variable not being manipulated. Yes, there is an independent variable present, but we're looking at the dependent variable and seeing, what were the factors that played a role in this dependent variable having this outcome. The limitations is that we can't determine causal relationships. So because we didn't, intervene in some way in order to cause the outcome, we can't say that the outcome was because of the intervention. It can only determine functional relationships, and the independent variable cannot be manipulated. Because we can't manipulate the independent variable, we can't say for certain that the independent variable was what caused it. So the example here is that periodontal disease, study adults over 40 years with periodontal disease and adults over 40 without periodontal disease. But we wouldn't be able to say that, we look at these people and we're like, okay, smoking is the #1 thing. Well, just because we look back and we say these people, more of these people smoke than of these people, we couldn't necessarily say smoking causes. The same thing goes with oral cancer. So, when we do, for instance, here's a good example with that oral cancer, a lot of times they will say that oral irritations, so like people who cheek bite, or they use a really abrasive toothpaste, or they're constantly causing some type of irritation in the mouth, that is a risk factor for oral cancer. Because when they look at people with oral cancer, they go back and they see, okay, a lot of these people bite their cheek, right? But we don't necessarily know that biting your cheek is going to cause oral cancer. So we can say that it's a risk factor because a lot of people do it, but we can't say that there's a direct link. All right, the next one is experimental. This is probably the thing that you think of when you think of research interventions, right? You think of, okay, I have these two variables. Here are my two groups. I'm going to manipulate something about one of them. One group gets something and the other group doesn't, and we're going to see what happens. Okay, that is experimental research, and it's the one that most people think of. So the reason we do this is to investigate cause and effect relationships. So we go in and we say, we manipulate something, we change a variable of some kind, and we say everybody in group A has this variable and everybody in group B does not have this variable, and we're going to see, does the variable change this other thing we think it's going to change. The methods for this is going to be the manipulation of one or more independent variables. So the thing we change is the independent variable, and it's going to control what happens to the dependent variable. The dependent variable depends on the independent change. The control of the extraneous variables. So in this way, we don't want other things getting in the way and, causing an outcome. So when we manipulate these types of variables, we also step in and say, hey, while this study is happening, don't do these other things that could cause a change. So let's say we're studying toothpaste and we're saying, we're trying to find out if an ingredient in toothpaste A is effective at whatever we're trying to do. Maybe it's whitening, right? So is toothpaste A going to whiten based on the ingredient? Toothpaste B doesn't have the ingredient, right? But you send the people home, you want to tell them, hey, don't whiten your teeth. We want to see if the toothpaste whitens your teeth. So if they go home and half of them are using Crest white strips, we have no idea if the toothpaste is causing the whitening, right? So we want to control those other variables. And then the measurement of the dependent variable. So we need to have a way to measure the dependent variable consistently from before we intervened and then after we intervened. And a lot of times with this method, we will use a control group. That's group B that doesn't get the toothpaste. The limitation here is that it's artificial. Because we manipulate it, it's not something that happens naturally in real life. We may or may not be able to say that it would work in a real life situation. So, we give the group toothpaste A and we tell them to brush 5 times a day with it, and they do, right? I don't know, those are good participants who are doing that for you, but they brush 5 times a day. Well, of course it makes their teeth whiter, because it's effective, but then when they go out into the real world, nobody's brushing 5 times a day. So are we able to extrapolate that outcome and generalize it to the population? We don't necessarily know, right? And then there's a decreased external validity. That's what that means. We may not be able to replicate it and make it work out in real life because it's happening in a lab. What happens in a research lab is kind of a unique situation. So examples of this are going to be the effective intraoral sodium bicarbonate rinses versus the standard rinse of the periodontal ligaments of dental patients. Wow, that's a mouthful. And then the effectiveness of calculus removal with hand instrumentation versus magnetostrictive ultrasonic instrumentation, right? These are the types of things we might introduce one and see if it affects the other. So for quasi-experimental designs, what happens here is it's close to a true experimental approach, but when we separate people into the experimental group and the control group, we aren't doing so randomly. So it's similar. We are comparing people with or without a condition or disease or whatever it is, but we don't randomly assign half of them to something. They're usually innate characteristics. So the example that I've always heard is that you would test something on different personality types. So you might have participants come in, you give all of them a personality test, and then based on their test is what categorizes them into their group, right? Maybe they're either introverted or extroverted, and so with the introverts you do this thing and with the extroverts you don't, right? But you didn't randomly assign them to those groups. They sort of randomly assigned themselves to the groups. So it's similar. I always hear of quasi-experimental, like also being called queasy, because true researchers they don't like to do these kinds of research studies because they're just not as valid as ones where you determine that kind of information. And then the limitations for this, again, you don't have as much validity, and you have a lack of control of a lot of those other variables. So other variables that can come and step in, like for instance with the personality test, is that you might be testing something that is dependent on not necessarily personality, but on the types of behaviors of someone who is introverted, right? Like maybe the introverted individual is more sedentary, and so you might find that you're studying something, but the sedentary variable is going to play a higher role than necessarily their introverted variable, right? All right, so in a retrospective study, which we already talked about, we are looking at a group of people with the disease in the past. Typically, we conduct that research with medical records in a hospital or some type of documentation from the past. In a case control study, this is different from a case study, right? In a case study, we're just looking at one. But in a case control, we have two groups. One has the case, and the control side doesn't have whatever it is. So don't get this confused with case study, where we only look at the disease or the person, right? We only look at basically the case. In case control, we have the case and the control. An ecologic study also attempts to relate the outcome with exposure to a suspected risk factor, but does so using existing data that are available for the population rather than measuring the exposure and the outcome of the same group. So in this one, they collect information that is readily available, and then they try to extrapolate that information and predict that kind of risk. So we see this probably in like insurance companies. They will research, various risk factors in order to figure out, is this person someone we want to insure? All right, so again, in experimental research, I want you to also kind of pair this with the term clinical trials, because usually in experimental research, it has passed the part where we're just gathering information and we're actually randomizing and sampling and all of that. It's probably the research that's most familiar to people. This is the one they think of when you think of research. And in this type of research, the experimental treatment or the intervention, the experimental research or the intervention is actually called the independent variable, and is studied in a group of people or animals. So the intervention portion is independent, and the thing that we're trying to figure out if it's affected is going to be the dependent variable. Maybe I'm just reading this wrong right now, or just weird right now, but basically, like for brushing, if we want to see if brushing will affect gingivitis, right? The brushing is going to be the independent variable. That's the thing we're going to change. And the gingivitis is the thing that's going to be affected, right? Gingivitis doesn't affect brushing. Brushing affects gingivitis, okay? So in this one, the dependent variable is whatever is being studied. Okay, it's going to be the outcome, although this is, again, worded weird. I might change this. It says the dependent variable may be a new drug or surgical treatment, right? The dependent variable isn't the drug or the procedure, it's the outcome after the drug or the procedure. The variable that will influence or is going to impact the dependent variable is the independent variable. All right, and then, so moving on past some of those studies, we get to page 202. This is box 16-1, and this looks at, this is on page 202. This is on page 196 at the bottom. This just looks at the types of characteristics that your research has to fall into. So any research hypothesis has to be ethical. We can't say, hey, I'd like to research how people feel when I cut off their arm, right? We wouldn't do that. That's not ethical research. Interesting, but not ethical. Necessary research that has the possibility to improve clinical practice and improve health policy. So we don't just research stuff for the fun of it, right? We want to research things that will help people, that where the information is going to be of use somewhere. And we want to either confirm or change previous theories. So we might say, all along we've been removing calculus, and maybe somewhere along the line we want to say, what would happen if we left the calculus? Like, why can't we leave it on there? Our bodies make it naturally, right? Maybe we want to challenge old beliefs for things like that. And then we also might, perform the research if it's going to recommend future research directions. So this one's more like your pilot study. So, you might perform a pilot study in order to be able to see, should I continue to research this in the future? Should other people research this? Staying in that same box, at the bottom it says fundable research that includes an adequate number of subjects. So the reason you did the pilot study was to find out, is this study going to actually find the answer to the question that we have? If so, then we need to make our sample bigger so that it will be more valid, which we'll talk about when we get to validity. But the bigger the sample that we have, the more likely that the results we get aren't due to chance. So we want, if we're taking money from people, we want to make sure that our study is going to be big enough to be able to actually give us a good answer. And then if our study is cost effective, because we never want to waste money, obviously. And then is the study manageable in terms of the projected scope? So, obviously, yes, we want to have as big a study as we can have, but we don't want to go so big that we aren't able to collect the data that we need. And then involves professional expertise. So they don't just give study grants to people who've never done this kind of thing before. Typically, you'll have like a lead or like the first author or things like that in the study. That's kind of the go-to person who's done this before, and they know what they're doing. And then it's not just someone who is, done research before, but also someone who's an expert in that field, so that they're able to, set the study up appropriately. All right, so this next step is the placebo effect, and this is a pretty common word. It's a pretty common theory that people, if they think that they're getting a treatment, they will improve. It's kind of a wonderful phenomenon. But so in a study, you have your experimental group, right? And most people think of drugs when they think of placebos. So if we go with the whole pharmaceutical example, then 1/2 of the study participants are receiving whatever the medication is that they're studying, and the other half are receiving just a blank pill. So they call it like a sugar pill, or but it's basically a similar looking pill. It's going to be the same size, the same shape, the same color, and it's going to look, and everybody who involved is going to think they're also potentially getting the medication. So what happens is that because people think they're getting the medication, their mental ability will actually create a physiologic response, and it's found in about 15 to 35% of cases where the people get better, and it's one of those things where it can't really be explained that well, but the idea that you're taking a medication and you should be getting better usually will make you get better. And then the next portion here, they talk about the Hawthorne effect. This is a concept in research where you can't necessarily say that someone is behaving a certain way because of your intervention. It could just be that they are behaving a certain way because they're in a research study. So for instance, you might have two groups of people who are in a weight loss study, and you have 1/2 of the study, on whatever the diet is, and the other half is supposed to be on their regular diet. But people, when they join a research study, no matter which group they're in, they typically lose weight. And that's not even like a placebo effect. It's called the Hawthorne effect. They know they're being watched, so they behave differently. If our patients come in to our clinic and we are, measuring gingivitis, and they leave, whether or not they get the treatment and the intervention, they're probably going to see that their gingivitis improves, because all of a sudden they know that they should brush every day or floss every day, or they know to do the things they already knew to do. So that they won't behave how they always have. They behave like someone's looking at them. All right. And another very common approach when you are conducting research is to have a certain amount of blind. So a single blind study means that the participant doesn't know if they are receiving the intervention or the control. In a double-blind study, both the participant and the researcher who is administering that treatment or intervention or whatever it is doesn't know. So back to pharmaceuticals, if the person is receiving the drug or the placebo, right, the person taking it doesn't know, right? Because if they knew they were taking the one that's not the drug, then they might not get better, or they might not behave a certain way. So we want them to think it's possible they might be getting it. But if the reason we would double blind, so right, the participant doesn't know, why would we want the person handing out the pills to not know whether they're the treatment or the thing, is because if they know that the person is getting the medication or isn't getting the medication, there's going to be some kind of tell, right? Nobody is very good at hiding information. So it's possible, that they might behave differently than, with one group over another, and they might pay more attention to one group over another. So let's say I know that the group, that the person that I'm talking to in a research study, that they're getting the placebo, and then they come in and they're listing all of their side effects. I might be a little less, I might not care as much about the side effects that they're listing because I know that they're not actually the side effects of my medication, right? So I might not be as diligent and as meticulous in my, recording if I know the person isn't. If I have no idea that person comes in and, there's a chance they're taking the treatment, but they might not be, then they come out with this list of symptoms, then I'm going to be, paying attention to every detail because I potentially don't want to give medications to people that will have terrible side effects. So the only thing that ever bothers me about research is when people get a lot of the terms mixed up. And so I heard once that somebody was saying that the thing was triple blind, and it just meant that all three parties of the thing were nobody knew what was going on, and that, I don't know, that's one of my pet peeves, is when people use research terms like completely incorrectly to mean other things that they just don't mean. And so you can have blind and you can have double blind, but beyond that you can't have any more blind. There's either one or the other. Moving to pre-test and post-test. So in this one, what they'll do, researchers will give participants a test in the beginning, then they'll do the intervention, and then they give them a test at the end. And what they're trying to compare is how much did the person change, how much did the participant either learn or grow or whatever it is from the first time they tested them until after they tested them. And this is really effective in a lot of places except for education. And then post-test only is where they don't test people before. They intervene in whatever it is, and then they just test them after. If you think about, both of them are used in education, but post-test is pretty common, right? We come in and we say, here's the intervention, is all of the the material that we throw at students, and then afterward we test to see, hey, how much of the intervention or the knowledge, the material did you actually get, right? The Solomon 4 group design, this is where they want to make sure that people learned, right? For instance, through education, they want to make sure that people learned the material because of the intervention and not because of the pre-test. So sometimes when you take a pre-test, it kind of clues you in on the things that are important that you'll need to learn, right? So when you take a pre-test, you have a list of things you're going to start paying attention to and you're prepared for when you see them. So then when you see them in the intervention, they stick a little bit better, right? So in a pre-test, well, in the Solomon 4 group design, what they do is they break them up. So if this pre-test and post-test is group 1, and then post-test only is group 2, they'll put half, well, 1/4 of the participants in this first group, and they'll put the other in the second. And so they'll break people into 4 groups. And so in this first group, these people are getting a pre-test. They'll get the intervention, right? And then they get the post-test, okay? But in the second group, in B group here, they're going to get a pre-test. Man, writing with a cursor is tough. They do not get an intervention, and then they get a post-test, okay? And what's this group is gonna tell us Did people learn from the pretest? Did they cue into whatever this was, and so then when they took it again, they learned from the test and not the intervention? And then in this bottom group here, they don't give people pretests, but they do give them the intervention, and then they give them the post-test, okay? And then in group B over here, man, these guys are really hung out to dry. They don't get the intervention, and they don't get, oh, let me put the X over here too. They don't get a pretest, and they don't get an intervention. All they get is a post-test. All we're trying to see is, where did people start out? Because they didn't get anything else. So that's how this works. In this Solomon 4 group design, we're going to be able to figure out, one, does the intervention work, which is the whole point of our research study, but also, did people learn more from the pretest, or did they learn more from the intervention? Or, you know what, maybe they learned more from having a pretest and an intervention. So that's how that works. Next concept is going to be calibration, and it's always based off of the researcher. Whoever is measuring whatever the data is, right? Whoever is collecting data needs to be calibrated. And so we have two different types of calibration here. And if you think about them as like intra and inter. So intra-examiner calibration is going to be a consistency within a single researcher to measure the same each time. And typically this is done through tools. So like if I were using like probing depths, for instance, it's important that I'm always using the same amount of pressure whenever I'm doing probing depths, that I'm always using the same angle, and that that I use the same probe, right? The same type of probe, at least one that is not broken or bent or any of that. So that way, every single time I measure something on a probing depth on someone, I'm going to get consistent results. And then inter-examiner calibration is going to be consistency between researchers. So, when we go in and we say you're allowed to be 1 millimeter off, right? That's because between any two people, we expect about a millimeter difference, even if we're doing all of the same things correctly. We're using the same amount of pressure. We're using the same angles, and we're doing the same type of probe, but we're doing all of the same things the same, but there's always going to be just a little bit different. And I mean, every time you probe the same person, you're going to be a little bit different. So here, if you think of like intravenous, right, is inside your veins. So that's the one person, right? And then inter-examiner, if you think of the interstate highways which run between state lines. So intra is within oneself, and inter is between researchers. Okay, so in keeping with more of those designs, those experimental approach designs, we have something called the crossover design. And this one is meant to really prevent those what-ifs in a research study. So, if I say this toothpaste can reduce gingivitis, and the person will go, well, what if that person just didn't have gingivitis? What if that person eats a different diet? What if that person, does it was such and such different, right? A crossover design is going to prevent those kinds of what-ifs based on those other variables when we break our participants in half. So let's say in group A, arm A here, the participants get the toothpaste, okay? And we see, does their gingivitis improve, or does it not improve? And then in group B, they don't get the toothpaste, and we're going to see, does their gingivitis improve, or does their gingivitis stay the same, right, or get worse? And then we have a period where we watch them, right? We measure them in the beginning, and then we measure them at this point right here. And then what we do actually is we have something called a washout period, where we stop giving them treatment for a little while. We have them kind of go back to normal, like reset their default settings. And then we bring them back in, but we switch them. So in group A, they were getting the treatment toothpaste before, but now they're down here, and they're not getting the treatment toothpaste anymore. And then here for group B, they weren't getting the toothpaste. They go through the washout period, and now they are getting the toothpaste. And so then we measure them here, and we measure them over here where, you know, we want to see amount of time. Did their gingivitis improve? Did it stay the same, or did it get worse, right? So in this one, if this person was just someone who doesn't build up a lot of calculus, and this person builds up, group A doesn't build up calculus, and group B does build up a lot of calculus, we're not really necessarily looking at calculus buildup for the purpose of our study, right? But I mean, ideally, one person is going to build up calculus consistently. If it has to do with other factors, then they would between two different people. So that way, if this person builds up a lot of calculus and the person B doesn't, or vice versa, however it works, that's not going to be a factor in whether or not my toothpaste affects gingivitis, because I tried it on that person, and then I'm going to compare. So maybe their gingivitis here improved. Maybe it's a good toothpaste. And so when they were getting the treatment, the gingivitis improved. But then when they were down here and they weren't getting the treatment, their gingivitis stayed the same. Okay, they're inflammatory markers, let's say. And then in the opposite side, because my toothpaste is statistically significant and it works, then down here for group B, this gingivitis would have stayed the same, or even potentially have gotten worse. But then after the washout period, they came up here and were getting the treatment, and so suddenly their gingivitis is going to improve. The split mouth design is where, instead of having this person, go through this whole process and then swap and then go through this whole process, what I do is I take their whole mouth and I just break them in half. And in this one person, I have this half of the mouth where they're getting the treatment and this half of their mouth where they're not getting the treatment. And sometimes in a split mouth design, they will still do a washout period and go again a second time, because they want to see, does it really, if you have a split mouth design and a crossover design, you're definitely going to find out if your treatment is correlational. So here we do the same exact person, because the idea is that if I test on all of basically the same participants, then I don't have a lot of variety between person to person because I use all the same people. All right, and then quasi-experimental approach. This is a review because we did talk about it in the boxes, but a quasi-experimental approach is an experimental approach that lacks inherent control. Remember that if you don't have enough control, you're going to feel queasy, okay? There. So the results can be used in this, like we might get enough of a result here that will help us design another further research study. But usually, because we didn't have any random control, right? We didn't randomize the people who are selected for the control groups. Remember, for their personality test, right? We can't randomly assign people personalities. They either have it or they don't. So because we couldn't have control over who got what treatment, it's not as good of a study. It doesn't tell us whether or not our intervention was effective, or if it was just that type of people don't have this problem. All right, so because this book is only has like a chapter or two to really discuss all of the research topics, we introduce sampling here. This book doesn't go into sampling very in depth, but your patent book will. So we're going to have a whole module on sampling later, but we're just going to introduce some of these sample sort of terms. And the first one is going to be random sampling. So if you think about like if we just drew names out of a hat, everyone whose name is in the hat is eligible to be chosen, and they all have the same chance at being chosen. They all have the same percentage or equal chance. And then in a systematic sampling, let's say I have my whole population here, and I'm just going to kind of put all of these people in a line. And then I'm going to choose every nth person. N can equal whatever number you choose. So let's say here I want n to equal 3. Not n necessarily as like the sample number, but nth is going to be the people I choose. So I'm going to choose this person, and then so this is the first person, second person, third person. I'm going to choose them, and then the next 3. Actually, that doesn't work that way. So not this person, because they're number 1. They're not number 3. So I would skip this person, choose this one, skip this one, choose this one, skip this one, choose this one. So that's how every nth person works. That's systematic. But that doesn't necessarily mean that every person, like let's say I lined them up like man, woman, man, woman, man, woman, man, woman, right? And then I chose every second person, or even just if I choose any even number at all, right, I'm going to get all men or all women. So I might want to break people into groups, and I'll have this group is men and this group is women, and then I'm going to line them up inside there and choose every third person. Does that make sense? Convenience sampling, oh, I'm sorry, when we break them into groups like this is called stratified. Stratified systematic sampling. Convenience sampling is where I have a population, but I have access to a portion of that population. So maybe all of the people who come in to the dental clinic are the people that I have access to here in the San Antonio area. So I'm gonna pull my sample from these people, and all of these other people that didn't make it into the clinic, I'm going to say that the information I find in my study, relates to them, that it will work for them, but I'm not going to give them a chance at being included in my study. So that's convenient, right? Because I have access to certain people, but it's not necessarily the best way to pull a sample. And then judgmental or purposive. So in this one, let's say my study is on, dental hygiene of people who are green. So I might only study people who are green, right? And so if I do this, then I'm using my judgment to say, well, green people, know about dental hygiene, so I'm going to only study these guys. As opposed to studying everybody and finding out, do green people actually know more about dental hygiene, right? That's the problem there with judgment, is that there might be variables that I can't account for, but I'm going to use my judgment to choose my sample and not let it be random. It's important that your sample is a cross-section of the population. And what this means is that, you're not studying all women, or you're not studying all green people, or you're not studying, all adults over a certain age. You want to have enough variety in your study sample that you're able to relate it to the general population. And the biggest example of this not happening is in pharmaceutical studies. So for the longest time, they didn't study women because when they did drug studies, the last thing they wanted was for a woman to become pregnant in the middle of the research study and for her to have to drop out because they didn't want to harm the baby. Or, heaven forbid, they were giving them a medication that does harm babies. The woman didn't know she was pregnant, and then, they've caused some harm, right? They don't want to do that. So for ethical reasons, they decided to only study men for certain medications. Well, the problem with that is that women don't respond to medications the exact same way that men do. Women aren't just smaller versions of men, right? We have different DNA. And so what happens is that because they only studied a certain section of the population, there is some bias that's there. So when they say it could have this side effect, this side effect, this side effect, they're not probably going to even know about the side effects that it's going to cause to a woman's reproductive system. This happens a lot in blood pressure and heart medications, because when they were first coming out with a lot of the more common ones, they were only studying men. And so now women react differently to heart disease than do men. That's actually a topic that I really think is fascinating. That I took a whole class on. That was like the differences in men and women as far as our health goes, and the fact that a lot of the treatment that's being done for women is not even studied on women. Okay, so we've made it through most of this chapter now, right? We came up with our research question, we figured out our research design, what kind of research approach we were going to take, and the design we used within that approach. And then we figured out, do we want to have a blind? Do we want to have a double blind? All that kind of stuff. We figured out, what kind of sample we were going to choose, so how we were going to go about finding our research participants. And then you collect data. That's what you do. You have your examiners calibrated, and they collect all of that information. Usually they put it into some type of statistical analysis if your data is numerical. If your data is not numerical, then you probably have a couple of people who are analyzing that data and trying to find key terms or finding correlations in the responses, things like that. The thing here that is probably, again, my favorite aspect of research is it's addressed in The Dread Tomato Addiction by Mark Clifton. This is in box 16-4 in your book. It's on page 207. And it's really where you can see how if you're not looking at the big picture of a study, you can get caught up in details and then make statements that aren't true. So in this one, it talks about 92.4% of juvenile delinquents have eaten tomatoes. Okay, 87.1% of the adult criminals in penitentiaries throughout the United States have eaten tomatoes. So informers reliably inform that all known American communists, 92.3%, have eaten tomatoes at some point in their life. 84% of all people killed in an automobile accident during the year 2000 had eaten tomatoes. Those who are subject to singling out specific groups for statistics require measurements within a total. Of the people born before the year 1850, regardless of race, color, creed, or caste, and known to have eaten tomatoes, has been 100% mortality, right? So every single person who died last year ate a tomato at some point in their life. I'm not going to keep reading this, but what this tells you is that according to this information, if you're not looking at the big picture, you might think that tomatoes cause juvenile delinquencies, that tomatoes cause criminals, that tomatoes kill people. But that's not necessarily true, right? Just because two things both happen simultaneously doesn't mean one causes the other, okay? Correlation doesn't equal causation. The example that I had heard when I first started, and I had my epiphany of how this works, was that in the summertime, there is more boating accidents, because more people get into boating accidents. Also in the summertime, more people eat ice cream. Okay, so if you were to look at these, they're positively correlated, right? So in the summer, more people get into boating accidents and more people eat ice cream. You might think that eating ice cream causes boating accidents, right? But it doesn't. They just happen to happen at the same time. So the factor here that we don't account for is the fact that it's summertime, and both of those things happen when the weather gets warm. That's how all of that correlation data works, right? That is why no single research study can prove a hypothesis, okay? No single one can, because there is potentially flaws in every single research study that is conducted. You have to have validity and you have to have reliability, which we're going to talk about, but you have to be able to reproduce that research study and see if it happens again and again and again consistently, because there's always a chance, and you try to account for this, but there is always a chance that your results were what they were just simply by chance. You just happened to get people who got better. No research study can be applied beyond the population that was studied. So, if you studied adults between the ages of 20 and 30 and you found a toothpaste that helps to reduce gingivitis, but all of your sample was between 20 and 30, you cannot say that that toothpaste will reduce gingivitis for everybody, because it might not, right? It might not work on kids and it might not work on older adults. So only make generalizations based on the population that you studied. And then the third one here is in the conclusion portion is going to be that the information should be peer reviewed and published. So if you collect data and you go through the entire research process, and it's a good question and it's a significant question, it's going to help the body of literature, then it is your responsibility as a researcher to publish that research. Even though publication can be tedious in certain scenarios, you still have to do it. You have an obligation by collecting information and having that knowledge to share it with others. And then you want to share it because it will go through a peer review process. So if you have your information and then you start only teaching people the conclusion of your study and you don't get a peer review process, there's a chance that there's a variable that you didn't account for and you're not 100% sure of. And so if you don't let others read your research and evaluate whether or not it was a good study, then no one can trust that you performed a good study. So you have to let other people in on all of those details and essentially let them critique you and let them pick apart the study that you conducted in order to see, does that study make sense from all angles? This is the end here. This is the last part of this chapter. All right, so totally unrelated, but this is my cat, Lady, and I didn't know there was like YouTube videos where you could watch just like birds and squirrels eat food. They're like meant just for cats, and so this is Lady watching the video. This is like how I work now, where I have to save a little tiny section of my computer space just for a video of a squirrel. But yeah, that's the end of this chapter. I know it's completely unrelated. It's a waste of time. But if you have questions, please make sure you let me know.